Get informed at contentdelaware.org.
We're very pleased to have Michelle Taylor with the United Way of Delaware with us today. Welcome, Michelle.
Thank you, John.
I'd like to just congratulate you on meeting the goal for this year for the campaign. That's tremendous, and you must be thrilled and excited about that.
Absolutely. We're very excited about reaching our $21 million campaign goal. But really, it's the thanks goes to the community. It couldn't have happened without the support of thousands of Delawareans.
Well said. And I'd like to just ask you to talk a bit about the core values.
Well, our mission is to maximize the community's resources to improve the lives of all Delawareans. And we are really focusing on mobilizing a community to work together to advance the common good around three key areas: education, income, and health. John, we believe that those are the building blocks for a better life for us all.
Yes, if you can get one generation, it builds one upon the next, doesn't it?
Absolutely, and we believe it all starts with education, particularly early care and education. We would want the kids in our state to start school ready to succeed, and then ultimately graduate on time to transition to post-secondary school or to the Delaware workforce.
Mm-hmm. I wanted to also ask you about how the public can get more involved with United Way of Delaware throughout the year.
John, that is a good question. I'm glad that you recognize, because in our old paradigm for United Way, I think people traditionally only thought of us in the fall as a fall campaign, but we really are working in the community 365 days a year. The community can get involved by giving. They can give at any time. But more importantly, we want people to advocate, to lend their voice in areas that they're passionate about, and to volunteer their time with programs and services and working in the community with agencies in order to make a difference.
Mm-hmm. Can you elaborate on how you're really keeping pace with the changing environment that we're all facing?
I think part of it, given where people are in the economy, is, we have to deal with the today and the right now. So, we really stepped up our focus with really trying to take care of the basic needs for people in our community, making sure that people have food, shelter, and utilities. But secondly, really trying to get more of the Delawareans back to work. So looking at things that we can do around workforce development, job training programs, so that we also connect to the state's priority about getting the Delaware community back working. But I think on the long term, at the same time, we are aligning our efforts with the Race to the Top and Vision 2015, and really trying to look at the programs and services that we're investing in on how it connects to help to advance that work. And our health pillar, we are working collaboratively with other partners in the state to think about healthcare reform. And what does that mean for the citizens of Delaware? And at the end of the day, how can we ensure that we are a healthy community individually and collectively? And then lastly, we're excited about helping to build some pathways out of poverty for people in our community. If it's from continuing to expand the EITC program so that it has a greater reach for those that need it, to programs that's trying to find alternatives to payday lending, or just finding ways to work with our agency partners to work more collaboratively so that we are providing more of a network for people who need services.
Even more efficient, effective, with greater return on investment.
Absolutely. Absolutely. And I think over the years we've also realized that the problems are too big for any one organization. It's too big for United Way, for the state, for any industry or sector, that if we're really going to try to combat some of the real issues that the people in Delaware face, we're going to have to work together collaboratively and pool not just our dollar resources, but I think leverage our think tank and our relationships and our connections in order to make a difference.
Thank you very much for your time.